Call the Senate Education Committee to order. Madam Secretary, would you please call the roll?
Yes, Mr. Chairman. Senator Ward Engelking, Senator Buckner Webb, Senator Den Hartog, Senator Souza, Senator Patrick, Senator Nonini, Senator Keogh, Vice Chairman Thane, and Chairman Mortimer.
Here.
Thank you.
Thank you, Madam Secretary. A quorum being present, we are now ready for business. Welcome to the Senate Education Committee. Our first item of business is a presentation for National Alliance for Medicaid in Education. Mr. Hill, Mr. John Hill, please. If you'd please come forward and state your name and your position for the record, and we look forward to your presentation. You're also welcome to introduce any guests that you have here with you, Mr. Hill. Turn that mic on just to the side there, Kayla.
Down on the bottom.
Right there. There, and speak right into it. You should be just fine.
Okay. Thank you very much, Mr. Chairman and distinguished members of the committee.
Mr. Hill, speak right into that mic. Do not
Okay.
be timid.
All right. It's been a long day, and it's going to get longer. Again, my name is John Hill. I am the Executive Director for the National Alliance for Medicaid and Education. I'm here, I've been invited here at the request of Representative Daley to come in to meet with several of the committees, many members of the state agencies and other parties that have an interest in Medicaid, school-based Medicaid billing. Our organization, you can go to the next slide, sorry. Our N.A.M.E organization is made up of, and specifically our board of directors, is made up of individuals from many different states. We have our basic mission of promoting and advocating for program integrity for school-based Medicaid services. We basically focus on three specific areas. One of those is working with our federal partners in Washington, D.C., both the Centers for Medicare and Medicaid Services and the U.S. Department of Education, in order that the services that are being provided, that the outcomes for the intended students are there. We also collaborate with our national partners, the state Medicaid associations of directors of Medicaid, the directors of special education at the national level, the American Association of School Administrators, to mention a few, and several other national organizations. The other thing that we do is that we basically try to provide a network among all of our stakeholders that are involved in the school-based Medicaid program. We do that by providing an annual conference, quarterly or bi-monthly topical calls on special issues around school-based Medicaid around the nation, as well as informal information sharing, which is kind of what I'm doing today at the request.
Great.
So I greatly appreciate, again, the opportunity to be here. Next slide. Okay. Again, our board of directors are made up primarily of state agency folks. So this is our take. We got together as an organization in order to try to get a handle on how this school-based Medicaid program works around the country. We formed back in 2002. We basically have 17 members. 5 of those are actually local school representatives from around the country, because we felt that as an organization, we needed to have their voice and input at the table. I mean, the regulations that we're putting into place and implementing at the state levels, these are the people that are having to carry out those activities and abide by those regulations. It only makes sense that we're as transparent as possible so that they have an understanding of what this is about, and also have a voice and offering alternatives and maybe how we go about trying to do what we're intending to do. Because the government's always really good about an idea, because they have, oh, we need to do this, but there's many ways to do this. And sometimes the idea that we come up with, and I'll speak from my hat that I wore as a state administrator, may not have always been the best idea. So it's real important to get all the voices there. The map basically represents where our board members have come from the past 13 years. And you can tell that we've come from a broad base across the country. Go back, yeah, that's okay. One of the reasons why we get the board members we do is because it's people that actually want to learn about the program, and there's nowhere else to do this in this type of situation. I was a founding member of the N.A.M.E and a past president of the organization. I also served as the organization's governmental affairs chair for about 10 years. A year ago, I left my 30 years of public service for the state of Indiana, where I worked for the Family and Social Services Administration for about half that time, which is the mega agency where our state Medicaid agency is at. Worked with our home and community-based waiver services program for people with developmental disabilities, was the first director of that program. I was also our state director for developmental disability services. That's where most of my Medicaid background came from the familiarity of having to deal with Medicaid in those particular settings. When I was there, I helped close 2 of the last 3 state institutions in the state of Indiana for people with developmental disabilities, and I realized that 2 out of 3 was enough, and I needed to have a respite from that particular activity. So I went over to work for our State Department of Education, where I've been for the past 15 years. And one of the major hats that I wore while I was there was working with our school corporations on expanding Medicaid reimbursement. One of the things that I'm focusing on is trying to improve the data that we're collecting. To my knowledge, every state in the country participates in the school-based Medicaid program to one degree or the other. Some go about it very aggressively. Some just kind of dip their toes in the water and pull down a very minimal amount of money for a very specific population within the school corporation. One of the issues that we have is that the federal government at their level does not collect any specific program information about this. They collect all kinds of Medicaid payment information in the aggregate, but if you go to them and find out, well, how much money did you pay for schools for these school-based services, they can't tell you because they don't collect it in that manner. So it's one of the things that I've been trying to do for the past year and a half is reach out to the states individually, talk to contacts like Art Evans, and the Medicaid agencies to try to find out exactly how good a handle and understanding do they have on the amount of money that's being spent for school-based services. As we're able to do that, then hopefully we can provide bodies like yourself better information of maybe what can be expected from one state to another by comparing from one program to another. I'm speaking to you based upon my knowledge in many other states, as well as my experience from Indiana, as well as working with those national partners. Slide 5. Again, focusing on the data. You move on to next 6. Okay. It's very important to note that the state of Idaho is already participating in this program. Like the slide says, like it or not, under the Individuals with Disabilities Act, states are mandated to provide services to students that are eligible, that have disabilities. This is a mandate that came with very little funding attached, which is one of the things that we're here to talk about today. And with the school-based Medicaid reimbursement program, what we're talking about is not about, in this case, of whether the services have to be provided, because they're already provided. This is after the fact. This is kind of like a rebate. You went out and bought something. If you got the appropriate documentation, you can send your rebate in and get the money, form in and get the money back. So that what we're trying to talk about here is exactly how and who's going to pay for the services. It's one of those few exceptions, and we all understand this, and you guys understand it better than anybody, is the state has so much money to operate. You have a pie. The pie's only so big. The only way, there's 2 ways you can increase that pie. One is increase taxes. Nobody wants to do that. The other is to find maximum ways to use matching dollars from other sources. This is one of those. This is a freebie. This is a way to increase your federal participation for these services by 70%. You're already paying for it at the local level with local funds. You can expand that to have the federal government pay 70% of the cost. There is no additional cost to the state of Idaho for doing that. As you know, when the IDEA regulations were originally passed, the federal government made a commitment to eventually provide up to 40% for those special education services. That's been about 40 years ago, and they're paying 15%. That's not anywhere near the 40. You can, of course, use 100% of state funds to pay for all of those services that the feds aren't paying for. Or, again, you can choose to use some of the state funding you're already utilizing to provide as Medicaid match to increase the amount that you can pull down. The good news is, in the state of Idaho, is you have the second highest federal match rate in the nation. It's almost 72%. When I began working with the Department of Education, the Indiana Department of Education back in the year 2000, neither at that point in time did our state Medicaid agency or our state Department of Education want anything to do with this program. The program is on the books. schools were allowed to bill. At that point in time, we had about 20 school corporations in the state of Indiana that generated $280,000 total in a year in billing for this program. And again, neither one of the agencies wanted to do it, basically for a number of reasons. The Medicaid agency thought this was a much too complicated system for our local schools to understand, and that there would be major issues and audit issues if they didn't do it. Schools and states were worried about, well, if the federal government comes in to do an audit and there's a big payback, where's that going to come from and who's going to do it? And the other one was that the federal government might end the program tomorrow. And if they end the program tomorrow, we become used to the money, and now the money's gone. How are we going to make up the difference? But this program's been around for 30 years. So 30 years ago, you said you weren't going to do it because you're afraid it wasn't going to be around tomorrow. You missed 30 years of opportunities to pull down, again, federal money for federally mandated services. We all hate the government overreach. It causes us all angst. They tell us we got to do something, and what our mantra in the past has been, if you're going to tell us, fund it. Well, here's an example of where they're willing to fund part of it, but we, or you guys, or the states, have to jump through a couple of the hoops in order to get there. When the 2002 recession hit in the state of Indiana, again, as I indicated, our state Department of Education, our state Medicaid agency really didn't want anything to do with the program. Our state budget agency stepped in, and the governor's office, and informed both the Department of Education and the Medicaid agency that they were no longer going to support budgets for those divisions using blue and gold dollars, because those were state dollars, if those same divisions weren't accessing and maximizing the red, white, and blue dollars available out there. That got their attention, and basically because, and even though in Indiana it's the same situation that you have here in Idaho. You have a governor that's an elected official. You also have a state superintendent that's a government official. They can't tell each other what to do. They really don't have to get along with each other. Hopefully they do to advance the education of our kids, but occasionally we run into rifts and it doesn't happen. The state budget agency said, I don't care. If you come to me and ask me for more money, why would I be giving you more money when you're not even accessing all the money you can get? Don't come ask me for more until you can show me that you've done what you can do to pull down the federal dollars. So they listened, believe me. Not only did they give that statement, but for a 3-year period of time, that state budget agency held collaborative meetings, collaborative, transparent meetings on a monthly basis where they required the State Department of Education to be there, the Medicaid agency, also invited 2 parent advocate groups, invited 3 separate school corporations from throughout the state of Indiana. There was a rural one, an urban one, and a suburban school, because we wanted them from different sizes, as well as the 4 billing agencies that worked with the schools. They charged the group to come up with a program that would work, that would maximize the federal dollars, but at the same time minimize the likelihood of audit exceptions. Out of that group, during that 3-year period, the state developed an expanded memorandum of understanding between the Department of Education and the state Medicaid agency that included specifics such as there must be joint training, there must be collaborative buy-in from both agencies, that there's ownership for this program. One of the things that the budget agency drilled down on a number of occasions, we're not talking about Medicaid money. We're not talking about Department of Education money. We're talking about state money. They drilled down that those state agencies don't make policy decisions. Policies or decisions are made in this building. Those agencies are then to carry out the intent of that policy. They made that extremely clear. So they expanded the memorandum of understanding about who was responsible for the oversight, who was responsible for doing training, all of which was expected and is done jointly. They discussed how the money would be transferred from the State Department of Education to the state Medicaid agency for the match, so that there was not an increased cost to the state of Indiana for this program. Also addressed issues around dispute resolution. What if one agency didn't agree with the other agency? Then who was going to step in to help resolve the problem? And of course, the answer to that was the State Attorney General's office. The other things that came out of that was that the committee worked with an outside entity to basically develop a billing guide program to provide schools with basic information of what it meant to be a Medicaid provider. Again, Medicaid schools aren't traditionally medical providers, so they had to have a better understanding. They also developed a specific billing toolkit for those schools that decided to participate in the program. They give them specifics about each service, service requirements, best practices, documentations, and all that kind of good stuff. What I can tell you is that $180,000 between the year 2000 grew to $8.5 million by 2005, based upon the additional information that was given to the schools to be able to do the program appropriately, and based upon the encouragement of the state agencies to participate in the program. Of course, there's still a lot of work to do. There's been ebb and flows. We've had recession since then. We had the Great Recession that had a huge impact on money that was available, but the parties are still working together to make sure that it can work. Next slide. So the question would be, why would anybody be against receiving federal funds for a program that's mandated by federal law? I put responsibilities attached because I was trying to be politically correct, but we all talk about strings. There's always strings attached to the money. So it's like, why would we want to do it? There's always strings attached. Strings around matching funds. You had to put up your state share. Well, in this case, there's a no financial impact on the state, again, because you're using already appropriate education dollars, so there shouldn't be a funding issue that's involved. There is local and state administration that is a cost to the program. There's a cost for the state agencies to monitor the program and oversee the program. There's also a cost to local school corporations to run the programs and oversee the programs. And then there were issues about accurate reporting, because we didn't want to fall into many of the issues around audits that have creeped up. It's my understanding that last year the state of Idaho generated about $20 million in Medicaid reimbursement, but it's also my understanding that that amount of money has been dwindling over the past couple of years, and there's also fewer schools that are currently participating, which I think is one reason why they invited me in to have some of this discussion with folks. One of the questions to answer is the degree that you, as state legislatures, want to encourage additional program participation in order to maximize that federal funding that's available and required to pay for those services that are mandated by IDEA. In order for Medicaid services to be billed, schools must ensure that the students and the providers meet all the eligibility requirements to either be a provider or to receive the service, and that there's accurate documentation, and that the services were delivered in a manner that's allowable under your state regulations. While in most cases these requirements are considered best practices anyway, there's certainly additional time and effort that's required, again, for processing those claims. With the introduction of more sophisticated software that to have available for the schools through electronic IEPs, through electronic case management systems, the documentation requirements has significantly declined over the past 10 years. To further decrease the burden of administration, what can be seen as a complex program, the majority of schools, as well as many other Medicaid providers, oftentimes access outside vendors to process their claims. We as an organization don't advocate for the utilizing those outside vendors, but in some cases, it may make some sense that happens. Lots of people go to H&R Block to do their taxes because it's too complicated. A lot of schools utilize billing vendors to process claims. It's not only schools that utilize such vendors, hospital corporations do the same thing today. Nursing homes often do it, clinics often do it, because the systems for claiming medical reimbursement have gotten extremely complicated. And they want to hire somebody that has the expertise and have trained their staff to do it. But again, regardless of how it happens, from our organization standpoint, is we want to make sure that it's happening with fidelity and that people are paying attention to the rules. This program nationwide is too valuable and too important, not only for our school corporations, but even more importantly for the students receiving services, to allow it to falter and go away. The responsibilities for accurately reporting deserve a little closer attention in areas, especially in specific concerns to the legislatures and our taxpayers. Audits are important. They're a good check and balance. Next slide. Okay. To the best of my knowledge, audit exceptions actually happen for 3 reasons. One is fraud. If there's fraud involved, there was an intent for somebody to illegally claim funds that they should not have claimed. Intent. They intentionally did it. In that case, there better be a trial. If guilty, somebody better be going to jail. Fines need to be paid. Most of the time, most audit exceptions don't involve fraud. They fall into one of the other two categories. There's a lack of understanding that's done by school corporations in many cases. They thoroughly don't understand the program. They don't understand the Medicaid rules so well, so they oftentimes make mistakes. That's not acceptable. They need to learn. If you're going to play the game, you need to know the rules that the game requires you to learn in order to do it appropriately. In the best interest of the state, their state agencies and other involved parties need to be providing very succinct, clear instructions and guidance to the school corporations. This is an important program not only for the schools, but again for the states. This program saves the state taxpayers money. It's important that it's done with integrity. The other type of audit error happens because of human error. I saw little Bobby on October 10th and delivered him speech therapy services. We worked on articulation services. We worked on a couple other things. This is the progress he's had. I go and I fill out the documentation that I did it, and I put down October 9th. An auditor's going to come in. They're going to see there was no service delivered on the 10th. You need to pay the money back. Unfortunately, they're right. That money needs to be returned. School, and that's a huge bureaucratic problem. The money needs to be returned. As soon as it's returned, the school needs to file the same claim over again, and the only difference is they put October 9th rather than October 10th. It happens, and unfortunately, it's the kind of the world we live in. There's nothing we can do that can prevent human error. I make mistakes. I really do. I've made a couple today. But there are things that can be done to minimize those mistakes. There's quality assurance checks that can be put into place. There's better automated systems that make sure that if little Johnny wasn't in attendance at school today, then the system shouldn't have accepted the fact that he was given speech services today because the attendance record wasn't there. Idaho is one of two states that I'm aware of that utilizes civil penalties for schools, other public entities, including schools, that have billing exceptions or audit exceptions. What I would ask is that you look really closely at when those sanctions and when those when those civil penalties are implemented. Shouldn't need to be implemented for the number one thing. If there's fraud involved, there's already all kinds of issues that are happening for that. When it comes under number two and even number three, you would need to look at why it happened. Were they negligent in doing it? Or did they truly not understand? And as part of that lack of understanding, the state's responsibility because they didn't provide the training that was needed and they didn't provide the resources, tools. That's a policy question. Again, the states can decide on how they're going to implement the program, how they're going to deal with the issues. What I find interesting, though, is the other state in the nation that utilizes civil penalties does it for very different reasons. The state auditors go in and they review the records of the schools that have filed for Medicaid reimbursement. They look at all the services that were delivered. And that particular state actually applies a civil penalty to the school corporation if they did not bill the federal government for a service that they could have. And their logic behind that is their failure to do their due diligence cost the state money. I'm having to spend state dollars because you didn't do your due diligence in billing the federal government for something you could have. It's kind of interesting. Next slide. Okay. Again, you got a program here. You got a program that has made some changes over the couple of years. It's my understanding that there is joint training that's going on and it's going on around the state. How well that's working, how good that is probably yet to be determined, but it's out there. So that's an important thing to keep in mind. If you decide to expand the program or encourage the program to be expanded, you have to have buy-in from both of your state agencies, from both the Department of Education and your state Medicaid agency. And buy-in just doesn't mean they can't just say, well, these are Medicaid regulations, so at the Department of Ed, we're not worried about it. They are worried about it. Again, this is a state program. It's not specifically tied to those specific entities. They have to collaborate. They both need to take ownership in it. The training comes from both ends. The services are mandated through IDEA. One of the reimbursement mechanisms is the Medicaid agency. They have to collaborate on how that's going to happen. as a state governing body, you need to assure that those two state agencies are doing everything they can to maximize that federal reimbursement. But at the same time, though, you have to minimize those audit exceptions. That's extremely important. We realize that. If you want all your stakeholders to understand the rules, you want all your stakeholders to understand the rules so they can operate the programs with integrity. There are several important issues that, based upon federal audits that have been done around the country and things that schools have struggled with that we know of. They deal with such things as referrals for services. There has to be a doctor's order. Now, the federal language indicates that you have to have a physician, and it goes on to name 4 or 5 other professional physician-type degrees, but then it also says other practitioners of the healing arts. States can decide who that is and what that means in various settings. The other issues comes about service authorization. Well, where's the authorization for services? In most states, it is the IEP. The IEP is developed by a team of professionals that look at the student's abilities, needs, and determine what's the best mean to meet that needs. It's basically the same thing as a prior authorization that usually happens for regular Medicaid. In most states, the states consider the IEP document to be that prior authorization for those medically related services. Practitioner credentials is something that's very important. Who can deliver and appropriately deliver speech service in a public school may not be the same person that can actually bill Medicaid for the service, because the requirements of education and certification are not always the same. It's fine to do it in school setting. The kid's getting speech, it's adequate speech, but if that particular person doesn't have the particular degree and the particular certification, then you can't bill the federal government through Medicaid for that service. It's important that everybody understands that. That's becoming a less and less issue today because most of the speech therapists that are coming in the systems today are graduating from programs that have those specific requirements from both the certification process and the degree side of it. There's also issues about medical necessities. One of the things that I often run to, especially when I'm talking in front of like the speech association groups, either at the national level or state levels around the country, is that they're oftentimes concerned that they're billing for services that aren't medically necessary. And usually what I ask them is, okay, so if you're at the school system or delivering the service to little Bobby, if little Bobby's mom had taken him down to the local hospital or the local speech clinic to get this service, would they have billed for the same service? And I've never got the answer to be no, they wouldn't have. So the issue isn't about where the service is being delivered. It's about who's delivering the service and where. The medical necessity part is something that each state determines on what's the appropriate way to determine that. You got a physician's referral or a practitioner for the healing's art. That designates a medical necessity. If those referrals weren't there, then the medical necessity wouldn't have been there. Service documentation is always a huge thing. Again, it's important that they document what they're doing, that they're showing progress, but these are areas that have to be addressed, and there's a number of others, but those are the highlights that we mostly see within the federal audits that come out where states have failed and schools have failed to do their due diligence. As you're looking, or as the state would be looking to either enhance their current program that they have through just the quality assurance that they're doing, or even expanding it from a standpoint of maybe able to pull down more dollars. In this region, I would suggest that the good states to look at would be Montana, Arizona, New Mexico, Colorado, Iowa, and Texas. Most of those states have recently been through or currently going through federal audits. There have been some major issues in some of those states, but we're better to learn what not to do. We already know that that doesn't work, so let's make sure that we don't do that the same way. As you're aware that every state Medicaid program is different, which also makes this program very complicated as we're trying to provide some assistance around the country. Reimbursement methodologies different, where the match comes from different, match rates different, practitioners' requirements are different. How the money that's generated can be spent varies from state to state. Some states mandate where the money either needs to stay in the education program. There's even a few states that talk about federal overreach. The schools would think it's overreach from a state level. They mandate the school to submit a report on how they plan to spend the money that they receive through Medicaid, and the state either approves it or denies it or sends it back and tells them to try again. Next slide. In closing, The federal and the state regulations, as well as today's societal expectations, have forced schools to become medical providers. If you look at the kids that are in the school today, they're not the same kids that were there 30 years ago. An example that I go back to from my experience in Indiana, our wealthiest school corporation, and wealthiest school corporation, I mean the residents within the school corporations were the wealthiest residents in the state. They had a very, very minimal Medicaid eligibility population within that school corporation. That particular school corporation came to us at the state level and said, we need to apply to get Medicaid reimbursement. So it was kind of interesting, well, why now? Because we know you don't have many Medicaid eligible kids. And their response is because they had two families, both families had a set of twins that were extremely medically involved, and the school corporation was having to pay 8 hours of registered nursing a day for each child. That was coming out of state line item money. That was money that they had to take out of their budget, and their budget to deliver other programs in order to provide the services that they had to provide to these kids. They wanted to start Access Medicaid to defray the cost for those nursing services. What they also found out, which was pretty obvious to me, not only were those kids getting nursing services, these kids were also getting speech and OT and PT because of their condition, as well as there was a minority of other kids in their schools that also benefited from the program, which then the school could recoup money from. There's things that I caution schools about. How do you use this money? It comes in. There is no guarantee that the money's going to be there tomorrow. I have no crystal ball. I can't tell you what's going to happen in Washington. If I did, I wouldn't be here talking to you folks today. Who knows? It's been around for 30 years. We don't know which direction it's going to go. What I can tell people, and I do tell people, it's there today. It's money that that's there available to provide funding for services that's been mandated for you to provide. School corporations, I also caution against using this money to primarily fund positions, and especially teachers' positions, because there is a chance, either through federal regulation changing or even regulations changing to the state level, that the amount of Medicaid reimbursement could go down, in which case now you got a shortfall and you got to figure out what teachers you're going to lay off. Your Medicaid populations also change. Going back to that example in Indiana and the wealthy school district. Once those kids graduate and are gone, is it really going to still be worth their while to continue to build Medicaid? Well, it depends upon who comes along behind it, but maybe not. It is a local decision based upon what each school corporation's needs are. So it's important to keep that in mind. What we do suggest that they spend the money on are those things that they typically don't have any money to spend anymore because of tightening budgets. In-service training. Use it to pay for people to come in to train all your school's personnel on how to work with a student with autism. Use it in that way. Use it for the in-service training. Use it to buy special equipment. Speech therapists, your OTs are always needing money to buy new equipment. Here's the money that's sitting there that can be spent to do it that way. It doesn't have to come out of the school's general fund. You don't have to take money away from another service. You can use it because you've expanded the pie by the additional federal dollars you're pulling in. The issue at hand is how and who pays for the services that are mandated and that are delivered every day currently in your schools. I thank you for your time, and I'm open to questions.
Thank you, Mr. Hill. Questions from the committee? I've got a question while everyone else is thinking, perhaps, Mr. Hill. You've talked about speech therapy and some of these other things. Could you just delineate for me for a minute, the services that would typically be billed under this program?
Yes, Mr. Chairman. Speech therapy is usually the biggest program or the second biggest program. It's the one that's consistently billed from one state to the next. Attendant care or personal care or aids, classroom aids are typically billed in a lot of states. Some states don't bill for those particular services because that attendant care or personal aid service may not be in the state plan. You can only bill for services through your school-based Medicaid program that are already in your state plan. Medicaid can't devise a program that basically says, well, we're going to allow schools to bill Medicaid for this program, but we're not going to allow anybody else. All the providers have to be treated the same. We understand that. So we got the personal assistance and the attendant care type of things. We got speech, we got OT, we got PT. There are nursing services that are typically billed for. There is transportation that's commonly billed for. There are, in some states, orientation and mobility training, especially for children, that's paid for. There's another big one that I'm leaving out. It's gone right this second. But those are typically the type of things. And it varies again from state to state, depending upon what particular services are available under the Medicaid state plan for that particular state.
Thank you. Other questions from the committee? Excuse me, committee. Mr. Hill, thank you so much for your presentation.
Thank you all for your
It's
time.
generated a lot of questions, I think, of what's happening in our system. We'll go forward from there. Please, Mr. Vice Chair.